Oh. Sorry.
Hi everyone. Sorry, I'd just like to start by saying thank you all for coming today. I didn't realise it would be such an emotional day, but to see so many turnout has been fantastic. We are here today because we have to be, not because we want to be. Yesterday, there were 56 people on trolleys in UHL. 56 lying on trolleys head to toe. No dignity, no respect, no compassion. Limited access to washing and toilet facilities, no privacy, being treated in front of other patients, having to disclose the most intimate of details in front of an audience. My husband died alone on a trolley in UHL in April 2018. Since then, despite promises, things have got progressively worse. How many other people have died in similar circumstances? We don't know, and we probably won't ever know, because UHL management have threatened the whistleblowers. Management are there to protect their jobs and their positions, not to support the overworked staff or indeed support the patients. They are using fear to intimidate and harass overworked and overstretched staff who deserve our appreciation and support for their hard work and dedication. An emergency department consultant in Waterford has estimated that 100 people from his hospital alone die each year as a result of the appalling state of the emergency departments. How many is that elsewhere? I have read that a conservative estimate for the country as a whole is 3,000 deaths a year. Let that sink in. 3,000 people die because of the lack of care in our emergency departments. Why should we accept this? We can only guess at how many other people die languishing on waiting lists for operations, treatments, etc. Who knows? We now have an opportunity to ask each and every candidate what they are going to do about it. We have heard lies and promises about the new 60-bedded unit and the amount of cranes there are in Duradoyle. Innes, Nina and St John's were downgraded in 2009, so we're talking 11 years later. The new 60-bedded unit is of course welcome, but it is long overdue and too late for the hundreds of thousands who have passed through the emergency department in those 11 years. We cannot allow our politicians to go to Dáil Éireann and forget about us. For too long we have been forgotten. And this chart, sorry now, not everybody will be able to see it, illustrates this far better than I can. The steady blue line across the bottom is the trolley crisis in Dublin, which fluctuates between 20 and 35,000 from 2006 to 2019. The other red line, which is the rest of the country, accelerates way past, we don't even know what the figure is now, 120,000. That was 2019. And the 120,000 figure does not include Saturdays, Sundays and bank holidays. So we could be talking 150, 160,000. Shame on those who have been in charge while this was happening. There can be There can be no excuses. We demand a decent, caring health service for all and support, and for us not to be forgotten when our new TDs go to the Dáil. The people of these counties matter. People before party. There are some candidates here today, and I would like to thank them, but they must remember that words are cheap. And we have heard all of them before. In the next week, when they turn up on your doorstep, make sure you ask them what their plans are for our health service. I don't want anybody to go through the trauma that my family has gone through for the last 2 years, trying to get answers and giving up because the system is designed to make it as hard as possible. My husband was worth more than that, and so are all the other people that have died on trolleys since. Enough is enough. Care can't wait. Thank you.